Hi, everyone. Welcome back to our next episode of Unprocessed Sugar. Thank you very much for tuning in. Today, we have the pleasure of my good friend and our family practice doctor, Dr. Gina Paz. He was here in Venice, Florida, right next door to Sarasota. And she and I have known each other for a number of years.
A lot of years.
A lot of
You
years.
fixed my kids.
Yeah, right? Yeah, kids keep us busy
Yes.
at home and here in the office. But she's been kind enough to join us today, and we're going to talk about cholesterol, the good, the bad, the myths, what we can do to make things better. Do we need to do anything? And what's out there that's really not necessary, what's real, and what's unprocessed. So, Dr. Paz, thank you very much for joining us.
Thank you
We
for having
appreciate
me.
it after a long day at the office.
A long day at the office.
Yeah, right?
It's Friday.
Friday, right? Of course.
Good.
And, got out and came and joined us.
Yeah,
we really appreciate
Thank you.
you taking the time to do that. Dr. Paz is a family practice doctor, as I mentioned, and you've been in practice here almost 20 years, I think, right?
Almost 20 years.
Yeah.
Man.
I know, it goes by fast, doesn't it?
Don't blink.
I know, it's crazy. It really is.
It is insane.
It is insane.
But 20 years, mostly in like Charlotte County and Venice area.
Okay, great.
Lived in
great.
Sarasota for most of it. So
Awesome.
yeah.
Awesome. And off topic, Dr. Paz has a company with her husband called Field Traditions.
Yeah.
I'd encourage you to check it out. We'll put a link in the description and our website, but I would highly encourage you to check it out. It's got some really neat products on there.
Proud of that.
Yeah, it's really cool.
We're
Not healthcare related at
Not
all.
healthcare at all.
For fun, right?
But super fun.
Super fun. So yeah, definitely check it out, guys. So today, like I said, we're going to talk about cholesterol. Well, first, why don't we start off with some basics? What is cholesterol? How would you define it or describe it?
It's carbon, hydrogen, and oxygen all mixed together. So lipids and different types of lipids that help our body function.
Mm-hmm.
And it's necessary.
Right.
It's just the bottom line is how much of it do you need and
exactly
the properties and all of that.
Right. So I always found it interesting that it's a hormone, a precursor to hormones. It's a sterol,
for sure.
And cholesterol, but a lot of different hormones have a relationship, or they're similar in structure or directly related to
Correct.
it. So it is very vital, as you said. So why is it vital? I mean, what are some of our body functions or body parts that need cholesterol?
Sex hormones, testosterone, estrogen, your brain needs cholesterol. Your body needs cholesterol. So it's not something that we want somebody to be afraid of.
Right.
It's a necessary part of our metabolism. And it's affected by a lot of different things, environmental, dietary. But the bottom line is it's mostly like sex hormones and that sort of thing.
Progesterone, testosterone, all those types of things.
Estrogen, everything.
Right. And our brain has got a ton of cholesterol in it, right?
Correct.
Exactly. So without it, you're not going to function.
No.
So you've got to have cholesterol. The myelin sheath, that's the kind of the insulation around the nerves that go through our body, is made of cholesterol. So, so you definitely want cholesterol. We just need to learn how to get it, how to control it, what's good and what's bad, right?
I mean, about 70 to 80% of cholesterol our bodies make on our own.
Okay.
And about 20 to 30% of it we get from diet.
Okay.
And so your body does a really good job at regulating it. Genetics obviously plays a pretty big factor in that.
Right.
But, your body does its best to kind of maintain.
Okay. So 70, 80%. Our body
makes
it
on your own,
and it's the liver, correct?
Liver makes it.
Okay.
It's either liver does most of it.
Right.
Absolutely.
Okay. So that tells me then that you could have no intake of it, and you'll
function for a while, right?
And
over time, right, your body will kind of reduce the production of vital hormones.
Right.
So you'll last for a while if you didn't eat it, but you need to eat it.
Okay. Good. So there's different types of cholesterol, right? And that's where I start getting confused, and kind of like the episode we did recently on fats. So what are the different types of cholesterol?
There's LDL.
Okay.
That's the bad.
Right.
There's the HDL.
Okay.
That's the good.
The good. Okay.
Triglycerides, which is the fatty component in the bloodstream.
Okay.
There's different particle sizes, right? So there's something called ApoB, and these are really small particle size. So quite honestly, when it comes to cholesterol, bigger is better.
Okay.
So the big stuff your body can metabolize it and excrete it, right? If you have
Okay.
an abundance. The small stuff is the cholesterol that deposits in our arteries, right? So if we have an
Okay.
abundance of LDL, an abundance of triglycerides, abundance of ApoB, that's when the
That's
cardiovascular
bad.
risk comes into play.
Okay. Okay. Yeah, because I've heard recently about ApoB and small particle, large particle, and in a little bit we'll talk about testing and things like
Sure.
that. Is it even necessary to do that? So those are our different types. Hey everyone, and thank you so much for checking out Unprocessed Sugar and our content. I would love it if you don't mind, please subscribe to our channel, either YouTube or the website. If you go to the website and subscribe, you'll actually get an email notification every time we post a new episode. And of course on YouTube, when you go back to YouTube, you'll get notified that we've posted new content as well. But it helps us grow our presence, helps us spread our message, really means a lot. Thank you so much. And so we talked a little bit about where it comes from. So our body makes it, our liver
But
makes
what
it.
we make and what we eat are actually, it's cholesterol is cholesterol
Okay.
is cholesterol,
All
which is
right.
kind of cool. I mean, there's
Yeah,
saturated
right?
fats and unsaturated fats, but cholesterol as a compound,
It's all the
body
same.
makes it and you eat it. It's
Okay.
exactly the same thing.
All right. So there's some obvious sources of cholesterol that we take in, but I mean, other than telling people what they already know, what are some of the sources that we get cholesterol from when we eat?
So, red meats, I mean, vegetables like
Mhm.
avocados,
Okay.
nuts, seeds, those sorts of
Okay.
products have cholesterol.
Right.
Now, red meats have, so there's a really big difference between saturated and unsaturated fats.
Right.
And so, we like to have people eat unsaturated
Mhm.
fats, okay? It has something to do with the bonds and the chemical
Right.
structure.
Right.
So the easiest way to kind of think about that is, if you have some bacon that's been kind of sitting around in your kitchen for a little while and it starts to like congeal,
Yeah. Right.
that solidified
Okay.
fat that kind of starts to develop on that bacon, that's saturated.
Okay.
And so that stuff is really hard for your body to get rid of. That's the stuff that deposits on your arteries. So even though bacon's really good,
Right.
love some bacon,
Right.
it's all about moderation, quite honestly.
That's a great mnemonic you just gave me of how to remember.
Yeah.
That bacon, that I know exactly, it's kind of a
Yeah.
gray off-white color, and
Yeah.
that's saturated.
That's saturated. And so if you have a
Okay.
glass of olive oil
Mhm.
or avocado oil, no matter if it's in the refrigerator, on the
Mhm.
countertop, it's going to stay liquid. Right.
Awesome.
And so
Okay.
your body has, it can excrete that. It has an easier time processing unsaturated
Oh, wow.
fats.
That's awesome.
Yeah.
Okay, good. That really helps me,
Yeah.
even an orthopedic surgeon can understand it
saturated
that way.
fats, right? Butter is
Right.
saturated. So anything that kind of congeals and
Okay.
solidifies in colder temperatures,
Right.
that's your saturated.
Okay, awesome. So what are some of the health impacts? So if I get too much cholesterol, whether my body's making it or I'm eating an outside source of it, what are the some of the obvious,
I
but
mean,
what are
it's
some of the
over
bad
time,
things?
right? I mean, these are things that, when I have, 20 somethings teenagers in my office and they have 20 something teenager diets, right? They're eating
Right.
unhealthy foods, blah,
Right.
blah, blah.
Right.
That's the stuff that catches up with us down the road, right? It
Okay.
takes time for those, bad fats to get into our blood vessels, and it causes cardiovascular
Mhm.
disease when we're a little bit older,
Right.
right?
Okay.
So that's the long-term implication of, either eating too much lipids or
Right.
just genetics.
Right. So that was the next part I was going to ask you about. So there are some people, they could really be good about their diet, very strict,
Absolutely.
but they're kind of doomed by their genetic
Yeah.
makeup,
Yeah.
and they're going to make cholesterol in
Correct.
abundance just from
There's a
their
couple,
liver.
there's a couple of different, elevated cholesterol syndromes, right? There are
Mhm.
patients who make really significant high levels of triglycerides. There's patients that can't excrete LDL particles. I mean, I have a
Okay.
patient, he's 23 and he's a marathon runner, and his cholesterol is awful.
Really?
And I can't ask him to eat better. I can't ask him to
Right.
exercise more. So in his case, we actually do have him on statin because the
Right.
long-term implications.
Okay.
So
Huh.
so nonetheless,
And this
it's
is all genetic.
genetics.
So sometimes I hear of people who have a family history of cardiac arrest, heart attacks
Right.
in their 50s,
Right.
and that's almost always a genetic type of
I mean, it can
situation.
be, right? I mean, I've had a couple patients today, when I'm trying to assess a patient's cardiovascular risk, there's
Mhm.
so many factors.
Yeah.
It's not a
Right.
one size fits all.
Mhm.
And so, if I have a patient who, hey, my dad had a an MI in his 50s, I'm like, okay, so was your dad a
Right.
healthy guy?
Right.
Was he a smoker? Was he a diabetic? Was he, did he have high blood pressure? What were his risk factors?
Okay.
Because yours, right, if you're a healthy person, you go to the gym, you're a healthy weight.
Yeah.
I don't know if it's genetics necessarily, or if it
Okay.
was lifestyle that really impacted
Right. Right.
what happened to a family member.
That makes a lot of sense, and I like how you said it's not one size fits all.
No, absolutely
And
not.
sometimes it seems like that's kind of the things are just forced that way.
Yeah.
To not individualize things
And we're
right?
getting good. I mean, I
Right.
feel like in medicine we're getting real good. We have a lot
Mhm.
of various tests, and not just the lab test anymore, but we have, like, we were talking about coronary calcium scores.
Right.
So
Right.
it's just another diagnostic test that we can utilize to really help risk stratify our
Mhm.
patients, and make sure that the medical therapies that we put them on are specific to them, and if it's
Okay.
appropriate or not, right?
Right. Right. So let's talk about the testing and the monitoring. I mean, there's the basic lipid panel.
Mm-hmm.
Then you get your LDL, your HDL, the ratio.
Right.
But I've been hearing in the last several years that there are these tests for the particle size and the ApoA. But kind of going back to that, it's not one size fits all. You don't necessarily need all those tests,
No.
right?
And
Okay.
honestly, in my office, I'm family medicine, and my patients come in for kind of routine labs, or even if I'm following up statin management, I don't do these, really aggressive,
Right.
extensive cardiac panels for the general patient, right?
Okay.
If I have a patient who has, diabetic, or have, family history of heart disease, and maybe they don't want to take statins,
Right.
right? I mean, I'm not a salesperson, but it's
Mhm.
my job to essentially make sure we're giving them, the right
What they
information.
need,
Hey,
right.
let's go a little bit farther. Let's
Okay.
do, the more extensive lab panel. Let's go ahead and order a coronary calcium score and see if, you're that patient who
Right.
has enough risk to warrant, going on medical therapy
Okay.
or beyond.
Because as I'm learning about all these different elements that I haven't been trained on or taught,
Sure.
and it gets overwhelming, and you start thinking like, I've got to have all these labs done,
Right.
but that's not
Right.
necessarily true.
No,
You
it's not.
individualize it based on
Correct.
history and
Correct.
family history
Yeah,
and
and
things
if I
like
have
that.
like the routine patient where they don't have a lot of family history, they're generally healthy, they don't have, a lot of
Right.
medical problems. We just do, standardized a lipid panel, and that's enough for most people,
Okay.
right?
Great.
It can be a little bit misleading in the patient who carries a lot of risk,
Right.
either personally or genetically.
Mhm.
And so that's the patient that, hey, maybe we need to take that step further.
Okay. All right. That's really good. So the cardiac calcium score,
Coronary calcium score.
coronary
Yep.
calcium score. I was shocked when you told me this yesterday that
Yeah.
insurance doesn't cover that
No,
test.
no,
And
it's not a standardized
yeah.
evaluation at this point.
Okay.
About $100, but for a
Right.
couple of my patients, it's been the best $100 they've ever spent.
Okay. It
Yeah.
really it unearthed some important
Yeah,
information.
absolutely.
But that's interesting because I hear so much being talked about it. I would have thought, oh, yeah, that's just a normal thing.
Yeah.
But it's not.
Not yet.
Right.
Not yet. I
Right.
will
Right.
say in the last, I remember talking about this in my residency about 16, 17 years ago, and it was kind of a nuance then.
Okay.
And it has a really great negative predictive value, right? So if
Okay.
it's negative, a
Right.
0, right? So it's a numeric value to how much coronary plaquing you have on your vessels.
Okay.
So 0, best
None.
possible scenario,
Gotcha.
up to whatever the sky is essentially the
Okay.
limit. So usually, if I have a number above 100 in any one particular vessel,
Right.
that really makes my ears perk up a little bit.
Oh,
Okay.
wow. Okay.
And there are definitely limitations to every single test that we
Of course.
do.
Right.
But coronary calcium scores, they assess coronary plaques, but they have to be calcified. So it doesn't
Okay.
assess non-calcified plaques.
Okay.
So those might be
Gotcha.
there,
Right.
right? So younger patients, if we do them in patients who are like in their 30s or 40s, right? They may not have had enough time to develop those
They're
calcium plaques
calcified.
yet,
Okay.
right?
Right.
Women,
Hmm.
little bit of variability there, in patients who have chronic renal disease, same thing.
Okay.
So
Wow.
just some factors that your doctor
That's
needs to be paying
interesting.
attention to.
Does it also give you any insight to calcifications elsewhere in the
Well,
body,
we
like your
have to
aorta?
assume, right? So we
Right.
say, hey, if you have plaquing on your vessels in your heart,
It's going to be
yeah,
elsewhere. Right.
very possible that there's somewhere else.
Yeah. I mean, that makes sense, right? When I was an intern in general surgery, and all the peripheral vascular patients who had bypasses
Yep.
all went to the ICU. immediately from the OR. And the attending we had at the time would say, they're all hearts.
Yeah.
They're all hearts. If they've got it out the periphery,
Yeah.
they've got it in their heart. So
Absolutely.
they all get treated that way.
Absolutely.
So yeah, that's interesting.
Yeah.
All right,
so,
good.
But it's a great test.
Okay.
I think it has a really great utilization even in the primary care setting.
Right.
You know, for me, I mean, I send my patients generally to my cardiology friends when, you know, I've identified something, right? So, because nowadays, I mean, we can do, I can do stress tests, I can do echoes, I can do coronary calcium scores, I can do angiograms of the cardiac vessels. So when I've identified something, I can go essentially all the way. And I'm like, hey, we got something, we need to be stented, or we need something bigger.
You really nail it down and then know exactly what the intervention, if any.
Absolutely, if any, correct.
Right.
Correct.
Oh, that's awesome.
Yeah. So
okay,
it's
good. Very good. So, is all cholesterol bad then? I mean, we kind of talked about this couple of different types.
Yeah,
I mean,
it's really not I wouldn't say like necessarily a good or bad issue. It's more about it's how high is the cholesterol, right? And over how much time, right? In conjunction with those other risks. So smoking is, I'd say the two biggest risks. I mean, diabetes, it has a coronary, it has a myocardial infarction implication, right? So when I hear a patient has diabetes, like that's how much cardiovascular risk they have.
Right.
So, you know, smoking is huge.
Right.
Diabetes is huge. And, you know, people maintaining a healthy weight. It's probably one of the singular most important things for people to do or try to do. Right. It's tough. Food's good.
Yeah, it's great, right?
Yeah.
It's very good. And that's a lot of what our focus is in different episodes. And in my learning, our diet as a society is, in my opinion, is the single greatest contributing factor to the chronic health epidemic, the diabetes
100%.
epidemic, the obesity epidemic. If we eliminated the ultra-processed foods, that alone would do so much.
It does.
You're Dr. Mark Hyman, I'm sure you're familiar with him, and he has said that 70%-ish of people with type 2 diabetes can be cured with diet alone.
100%.
Yeah.
I tell my patients all the time, I'm like, make me take you off your medicine,
right?
Please. I would love to. It's like it's a good day for me when I'm like patients come back and you know, for whatever reason they're like exercising now and they've changed some things at home, and I'm like, oh my gosh, look at this, man. You're
That's awesome.
You're not a hypertensive anymore. You're not a diabetic anymore. How cool is that?
That is cool.
Yeah.
And you know, that's, I don't want to sound like a kiss ass, but that's one of the things I love about you in your practice is that you don't want to just throw a medication at somebody, right?
Yeah. I hate taking pills. I hate prescribing pills. I know that they have the role, undoubtedly, but I think honestly, there's so many medical conditions that we can treat by doing a more natural approach to managing your health. And
those approaches address the root cause.
Yeah.
Where medications, for the most part, usually are just kind of going after the symptom or the manifestation.
Even statins. I mean, we have we've been using statins for years, but from a primary prevention standpoint, which means, you know, we have a patient who's not a cardiac patient, a labeled cardiac patient. You know, we don't have any long-term data, right? Like 5 years or less. That's kind of the typical. I mean, it's not a reason to withhold statins where it's appropriate.
Sure.
You know, that being said, you know, it's what it is. You know, secondary, we know that there's very clear benefit when we have a patient who has had a heart attack or something like that.
Sure. So they've kind of established the fact that they're in a subcategory that really has to be more aggressive with their treatment.
That's right.
Okay. So we were talking about medications and different ways we could potentially be treated without a medication. So there's lifestyle things we can do, for example. What would be some examples of things I can do to treat my cholesterol and not take a pharmaceutical?
I think I try to simplify it as much as I possibly can for myself, for my patients. I tell them 3 rules, like for life. Colorful food.
Okay, good.
Portion controlled. And move. That's it. Literally 3 things. Because I feel like over the course of my life, you know, when I've been on diets, quote unquote, like all I think about is food. I think about how hungry I am. I think about what I'm missing out on. And it gets cumbersome. I'm not going to weigh food. I'm not going to read labels for the most part. And, you know, I try to stay away from processed food. My husband is a super amazing cook. And, you know, his family's from Spain and they don't eat processed food. We don't use a microwave. I mean, we're
That's
just,
awesome.
we try to keep it as simple as
Right.
possible. And
Whole
I think
food,
whole
whole food,
foods,
right? Whole
and
foods.
people just don't cook for themselves
Right.
anymore. You know, it's like you don't have to cook some, you know, crazy
Right,
meal, but
right.
making it as simple as possible, as
Yep.
colorful as possible. I think that's
Okay.
the easiest,
I like that.
simple thing people can
Right,
take away from
right.
it.
Good, good, good. You know, we have, as a society as a whole, we've traded our health for convenience. I want
100%.
quick, easy, go, 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 but you just ate a bunch of junk.
Yeah.
You know,
And you just feel bad after. I mean,
Yeah.
I mean, I know when I indulge
Right.
on occasion, I'm like, oh, what
I
did
know,
I
right?
do?
I did. I think I had a McDonald's cheeseburger a couple of years
Yeah.
ago, and it had been 5 years probably
Yeah.
since I had one. I
You
didn't
feel like
feel so
terrible
good
when you don't
afterwards.
eat it for long periods of
Right?
time. You're like, oh
Yeah.
man,
You
what
know,
did I do?
I know it's not good. So that was some food and move, and then there are some supplements that I actually took. So I was on a statin for, I don't know, 15 years,
Okay.
and I stopped, and I took bergamot,
Yep.
which is a citrus,
Yep.
lemongrass, and red yeast rice extract.
Awesome.
And I got my panel done, and it was fine.
That's great.
I mean, it's high normal, but it was fine,
Yeah.
right?
Yeah.
So, and then in combination with just, as I've been learning this, eating better.
Right.
Yeah, so I was so,
It goes
I
a
was so
long
happy
way.
about that. Right?
I mean, you know, I have had, for instance, you know, patients who have carotid vascular disease,
Okay.
and you know, they've changed their diets considerably to reduce like red meats and
Mhm.
you know, the saturated fats that we talked about. And over time, as we're monitoring them, we actually see regression of the plaquing, right? And I
Really?
have a couple patients who are like,
Oh my
not doing a
gosh.
statin. No
Okay.
matter what you tell me, I'm not doing it. I'm going to go green. I'm going to do everything
Right.
that I'm supposed to do, quote unquote. And I mean, it's really considerable, the impacts that people can make just doing
Wow.
those basic things.
So you can have plaques
Yep.
from a lifetime of badness,
Correct.
and they can actually improve.
They
and go.
can. I mean,
Wow,
you know, it's
I
kind
didn't
of a
know that.
risk you take, right?
Right,
Because statins,
sure.
you know, statins, what we do know that they do for us is, you know, they move the dial on paper. Okay.
Okay.
So they reduce your liver's synthesis of cholesterol. That is what statins
Okay.
do. Okay. And the other thing that statins do is if you have a plaque on the inside of a vessel, what it does is it makes that plaque, the top of it, kind of hard. And I know
Okay.
that sounds weird, like why the heck would you want that? But in a heart attack and a stroke, what happens is those
Right.
plaques rupture, right?
Right,
And so
right.
all the stuff in your body goes there to fix it, right? But they're not actually fixing it.
Right.
They actually plug the vessel, right?
Okay.
And so
Okay.
that's the other role that statins play that is very unique to statins.
Okay.
And so that's kind of the clear winner when it comes to the statin.
All right, that makes a lot of sense. So that works on the body's production of cholesterol.
Correct.
It doesn't affect your intake of it at all. So you
No.
still have to be, you know,
Yeah,
reasonable
it's
about
not
what you're
the,
doing.
hey, you can, you know, here's a
Right.
statin and now you can like eat at
You're like an
McDonald's 6
idiot.
days a week. You
Right,
know, it's like
right.
I have patients who do that, I'm sure.
Yeah.
But it's, you know, it's not the way it's supposed to be done, right?
They think they can have their 17 ingredient
Yeah.
French fries.
Oh gosh.
Right? It's
Yeah.
kind of nuts.
Yeah.
All right. But I was thrilled. I mean, like I said, I'm high normal on my
Okay.
lipid panel. And I think one time one of them was just a little over, but you know, I was like 3 something before.
Yeah, that's a
Yeah,
big difference.
right?
Yeah, that's a big difference.
Yeah, big difference. So, but again, it's definitely heavily influenced by my diet. We eat whole
huge.
food, and it really doesn't. It just takes a little planning ahead of time and
That's what
grocery
it is.
shopping.
We're all
right?
busy. I mean,
Yeah.
you know, we're all busy running, and you know, you just have to
Mhm.
plan.
Yeah, right.
You just have to plan just a
Yeah.
little bit.
A little bit, like I
Yeah.
said, not much, not much at
Right.
all. Okay, good. So we've been talking about treatments here and there. The statins. I had just mentioned a few supplements. Does that kind of cover it all, or is there anything else
I
out
mean,
there, or
there's
maybe
a lot
something
of, you know,
new coming out?
non-statin. There's injectable,
Okay.
you know, cholesterol management medications now that have been out for several years, and you know, statins stop your body from creating it, and the medication, for instance, like Repatha, it's an injectable, and it kind of neutralizes what's made in the circulation. So it's kind of like
Okay.
seatbelt and airbags. That's the
Okay.
best way to kind of
All
think
right.
about that. So those are kind of the medical things. I mean,
Mhm.
there's fibric acids. There's so many.
Right.
kind of a natural thing. High fiber diet is really important, not just the colorful stuff that we've been talking about, because your body kind of creates with bile acids. It kind of creates like a gel around cholesterol, fiber plus bile acids, and comes out the other end, right? So high fiber diet is also one of those things that patients can do that's easy, and it really does make a huge impact.
So I've recently, a few months ago, started the psyllium husk, which is Metamucil.
Perfect.
And but I didn't. A secondary benefit is what you just mentioned. I started using it because I'm trying to restrict my caloric intake, and it fills you up.
Full.
Makes you full. So I get those hunger pains, mid-morning, mid-afternoon. I'll have a glass of that, and a teaspoon, and
you're better than me. I can't stomach it.
It's gross.
I'm like a Benefiber person. It's like tasteless, odorless. If I have to go down there, it's like tasteless and odorless.
Okay,
like
it does the same thing.
Same thing.
Okay, well I got to look at it. Guys, it's pretty nasty tasting. I don't take the Metamucil, which I think has some flavored ones. It's just a psyllium husk, organic, non-GMO type of thing. But
any kind of fiber, whatever you can tolerate.
Okay, good.
Go
so a
for
secondary benefit is that my cholesterol will be better. Now, will exercise affect my cholesterol?
Big time.
You're talking about moving. It will.
Big time.
Okay.
Yeah, big time.
Really?
It increases HDL, which kind of gobbles up the bad stuff and helps your body excrete the cholesterol. So, HDL panels, a lot of times when I see review lipid panels with my patients, when I see a low HDL, that's probably more genetic.
Okay.
And so I'm like, all right, so obviously your rest of your panel looks real good, but your good cholesterol is low.
Right.
Get yourself moving. Let's see how that does. And usually it does.
Do we know how that works? Why does exercise make your body fix your HDLs?
Well, it starts to create HDL, and it starts to change the way that your body excretes it. It changes your insulin, right? So if it normalizes your insulin, it reduces your cortisol. It reduces the production of your body's endogenous creation of cholesterol.
Nice.
So that's all very interconnected. And so exercise is really important. And I think, exercise guidelines, we want to do about 150 minutes of exercise for the week.
Right. Okay.
Of moderate and 75 minutes of high intensity exercise for the week. Those are guidelines.
Okay.
So I'd say it's, I'd like to say, everybody's kind of getting out there and hitting it, but it's,
But that's something to strive for.
Yeah, it's about 30 minutes a day, 5 days a week of moderate intensity activity.
That's good. Yeah, I've got a cortisol elevation issue, and I'm kind of just really started to fine tune a protocol.
Yeah.
And the exercise just keeps coming up.
Yeah.
You've got to
it's a big one.
Got to move, right?
Yeah, it's a big one.
And then, so that's getting going and moving. I know a little off topic, but I also am adding to some quiet time.
So important.
Just
sleeping,
be still.
Yeah,
right?
sleeping, de-stressing, which for the American society is like, what's that?
Yeah. Well, and that because of the high cortisol, it's affecting my sleep. So
it really does.
But it's it just takes consistency and diligence.
It does.
It works.
It's kind of setting boundaries, saying no.
Right. We were talking about that before.
Exactly. Like giving yourself the time to be good to yourself is actually really, really important and necessary.
Right. And that's something that it's not in our training to say no.
It's not. It's hard.
We're supposed to always be there and go. And especially, I remember an internship that the attendings and chief residents would be going home for the night. You're staying there to take call. And it's like, if you need anything, just call.
Sure.
It is a sign of weakness.
It is.
But you can call. I'm like, okay, great.
Yeah.
So, but it is. It's time to just take care of ourselves and be still is something I'm learning how to do.
It's hard to do.
I'm kind of a hyper person
as
well, and it's like to just sit and do nothing.
Yeah.
For real?
Yeah, it's
but
really
it has
hard.
such major impact.
For me, like I enjoy kind of the do nothing for me is like, being out in my garden.
Right.
I love to pick weeds. It's like the craziest thing, but nobody's talking back to me while I'm picking weeds. I'm just out there. It's quiet.
It's awesome.
Like, that's, just doing something that you enjoy. Whether it's like sedentary or like you're moving around. I'm not a sitter. I have to like move around. But that's
awesome.
something, whatever you enjoy, you gotta take some time to do it.
This past season was my second year doing a garden at home, and did some raised beds and some planters and things like that. And like you said, it's just going out and bending and squatting.
Yeah.
And, I saw a documentary about the blue zones around the world, and one of the, for those of you out there who don't know that, I think there's 5 or 6 around the world, and they're areas where people live a lot longer than the rest of the the population, and they've identified a few factors. One of them is they labor.
Yeah.
I don't mean working in an iron foundry,
Yeah.
but the garden.
Correct.
A lot of them will garden.
Correct.
The squatting, the bending,
Yeah.
the lifting. You're getting range
Yeah.
of motion. You're getting a little cardio, but you're getting
Yeah.
strength. And
Yeah.
like
they enjoy their lives. I mean,
Right.
really, they enjoy their lives. They live off the land. I mean, of course, everybody has some level of stress, but
Right.
it's a different.
Mhm.
My healthiest patients, honestly, I think about this all the time after almost 20 years. Like my farmers,
Right.
and I have a lot of patients from like the Caribbean island where they
Okay.
don't eat processed foods,
No.
and they're always
Right.
moving. They're
Yep.
doing
Yep.
something. They walk, whatever that
Right.
is. But it's kind of like people who constantly are moving in
Right.
some capacity.
Right. So as I learn more and more about how to be healthier, it's really not that hard. You've got to
No.
learn it
A
and
little
then
bit of
just do it.
dedication
You just got to
and just do it.
right?
Yeah.
But moving.
Yeah.
It's just that can't get more simple than that.
Yeah.
At Whole Foods, pretty simple. It just takes time to plan ahead and then time to cook and make it and clean and all that.
Yeah.
But it's things that I just didn't know. And we're talking about it
It's
now.
simple.
So we
I
can
mean, it
learn,
really is. It's like trying to simplify it as much as
Right.
possible,
Right.
because I feel like the more rules and things and boxes you have to, I mean, then it just becomes like a stressful
Right.
event,
Right.
and that's not what
Yeah.
I want to make for that.
The things
for
you're doing to
anybody.
de-stress are making you
Yeah,
stressed,
I don't wanna
right?
make it
Yeah, a little
stressful.
counterproductive.
Yeah.
Okay, very
Yeah.
good.
Yeah.
So, are there any topics or subtopics we haven't quite covered? Do you think would be important for
Well,
us to hear about?
just how much cholesterol does a
Okay.
person actually need
Right,
for the day, right? So it's about non-cardiac patient, about
Mhm.
300 milligrams, which, believe it or not, it's about an egg,
Okay,
right?
Doesn't
Or
sound
about
like too
3.
much,
It's not
right?
a ton.
Okay,
I mean, portion. This is kind of where I'm going back to like those my 3 rules that I talk about literally day in and
Right.
day out. Like it's the portion control, right?
Mhm.
Our bodies don't need as much food as we give it
Right.
on a regular basis, right?
Yes.
So the cholesterol that you need for the day is about 300 milligrams
Okay.
for non-cardiac and 200 milligrams for a
The
cardiac patient.
Okay. And you can get that in one egg.
Yeah, one egg.
Okay.
And or like 3 ounces of shrimp or shellfish or whatever it is that you're after.
Okay.
So I mean, that's what your body needs for the day, right?
All right.
And if you're like, well, I have 2 eggs every day, but I exercise and
There
I'm
you go.
kind of working that off, and I'm kind of burning that fuel.
Right.
Fine, you can have more, right? If you're exercising more, then you get to eat more.
Right.
Right.
Well, it's like the T-shirts I see people. I run for pizza. I
Yeah,
run for.
Yeah, and that's
so-
okay.
right?
That's
Yeah,
okay. Like
yeah,
you can
right.
have more caloric intake when you're
Working
expending
it off.
more.
Right.
Yeah,
Okay.
expending more
All right,
activity.
good. Eggs, poor eggs. They've been vilified for
bad
so
rap.
long. Right? I mean, I mentioned this in another episode. In the 70s, they came up with processed eggs,
I
egg beaters.
know.
Like, you take an egg and you're going to process it?
No.
What kind
I
of sense
know.
does that make? But that's when the animal fat thing went
Yeah.
crazy.
Yeah,
That we're finally coming through that fog, I think,
Yeah.
and realizing, no. Animal fats are good.
they're good, but
the right
listen,
ones in
everything
the right
in
amount.
moderation.
Right.
Everything.
Exactly.
I mean, everything.
Exactly.
I don't care what it is that you're doing. Really, it's
Right?
like everything in moderation.
Yeah.
Probably not a bad rule to follow.
I think you're right. I'm trying to think of anything that wouldn't apply. I can't think of one.
Yeah.
But I'll give it some thought tonight as I'm giving candy to the
Yeah.
trick-or-treaters. Right?
I know.
Oh, I love
I don't
it.
want to be that house that's like, here's an apple for you.
Yeah, right?
Yeah.
Here's some broccoli.
Leave her house. Don't go to her house.
Yeah, they'll go to get the egg and they'll thank your house with
Yeah.
it. I mean, I heard people do that. I've never done it.
Yeah, never.
No.
No. Yeah.
All right. Well, good. So really, you don't need a whole lot.
You
can
don't
get it pretty
need a lot. No, that's
easily.
kind of like what your body actually
Right.
needs. But again,
Yeah.
you can have certainly more than
Mhm.
that. But
And then do
you need to
something
exercise.
balance
Do
that
something
out.
to balance. Yeah.
Good. Perfect. All right. Well, this has been awesome.
Thank you.
I can't thank you
Super
enough. I
fun.
really appreciate you being here. And I
Thank
know
you.
I'm pretty sure the audience will get a lot out of this
Love
as well.
it.
But this was great.
Love it.
So now I've got a few little follow-ups. I've got to go do some reading and some research. And,
Yeah.
so at some point, I want to start to. I hate to use the word controversial, but there's a book I have, it's the cholesterol myth. And there's a
Mhm.
lot of controversy about, is it as bad as it's been made out to be, which we know it's not.
Yeah.
And our
no.
statins, as what the pharmaceutical companies
Well, I
make
feel
it out
like,
to
listen,
be.
no medication comes without risks,
Right,
right?
right.
And so, in that, a special population of patients.
Mm-hmm.
If their benefit outweighs the
Right,
risk, well, then
exactly.
here's your pill,
That's
right?
it, yeah, exactly.
And believe me, I understand when my patients are like, oh, I just don't want it. I don't want it. And
Right.
I give them kind of that same speech.
Yeah.
I'm like, I'm not a salesperson, and I'm
Right.
working together with you,
Mm-hmm.
you know, to optimize your health.
Right.
And so here's, you know, if you choose not to take it here,
Just
you
do
know,
these
this is
things.
potential consequences.
Right.
If you're wanting to start the medication, cool.
Right.
Let's go forward. Sometimes that, you know, I don't want to say push patients towards medical therapy or doing quote unquote the, you know, the risk reduction technique that I think would be best for them. It takes time.
Right.
And, you know, it's just a relationship thing, right?
And that kind of leads to a comment I was just going to make. I'm loving hearing that from you, that you're working with them, and it's not the one size fits all. And if people have an aversion or a preference for one way or the other, that you can work with that.
Right.
You know, it's not this is how it's going to be. I'm the doctor, and
Yeah,
this is
I
what you're
think,
going to do. You know, those days are gone.
That time is
right?
kind of gone.
Yeah.
I mean, it used to. I mean, what, a century of that kind of. Here's what I said,
Right.
and this is what you're going to do.
Yeah.
But I really feel like it's very important to explain to my patients.
Exactly.
Right. This is where my head is. Right. This is why I'm ordering this test. This is why I'm suggesting this therapy. Right. And then we can all kind of leave feeling good about the plan.
The more educated a patient is, the more they're able to participate in their care, and the more compliant they're going to be.
100%.
Right? So it's a pretty
100%.
simple thing, but
Yeah.
well, again, this has been great. I
Thank
really
you so
appreciate you
much.
joining us.
Thank you.
Everyone, again, we'll have some links in the description, and if I could ask you to subscribe. If you go to the website and subscribe, you'll actually get an email notification every time a new episode posts. But we really appreciate your support. It helps us grow, get our message out to more people. And just something on a real quick personal note. I met Dr. Paz, oh gosh, I don't know.
Oh my gosh, my daughter was probably 10 years ago. Okay. Plus.
Right.
Yeah.
And so okay, she had gotten hurt.
Oh, yeah.
I fixed her up.
Yeah.
But when I met Dr. Paz, I think you'd been in her room overnight, all night long. And this is one of the reasons why I love you. She had a Journey concert T-shirt on
for days.
It was for days. It was awesome. She lived at.
I thought about wearing it today. Actually, I still have it. It's got like a couple holes in it now.
But that was awesome. But it was because you were at the hospital for a few days,
yeah.
and then that Journey T-shirt. So I still have that visual in my mind. It puts a smile on my face. So again, thank you everyone for joining us. We really appreciate it. There's all kinds of good stuff. We're building our content on the website. But we've got a recipe book, if you will. I think there's 8 or 9 recipes for homemade salad dressings, all with nice natural ingredients, very easy and simple to make. 4 or 5 ingredients. You go to the grocery store, you look at a label. I'm kind of a big label guy. And there's like 20 ingredients in these things. I was picking up a pint of ice cream at one place and it had canola oil and sunflower.
A million things.
And
I make one like for most nights. It's like olive oil, lemon juice, mustard, salt and pepper. Boom.
Yeah, yum.
Done. We're done.
Right?
Yeah,
so
that's all you need.
So
it's so good.
All right. Well, thanks
Thank
again.
you.
I look forward to having you back.
I appreciate your time.
All right. Absolutely. Thanks so much.
Awesome.
Bye, everybody. Thank you so much. Hi, I'm Dr. David Sugar, a doctor here in Florida, and thank you for joining us on our podcast. A quick note, this is for educational and general information purposes only. Listening to this podcast does not constitute a doctor-patient relationship, and please consult with your own healthcare provider before making any changes to your own care. If you are having a medical emergency, please call 911 or your local emergency number. Any items, tests, medications that we talk about or discuss are for information purposes only and are not an endorsement. Once again, thank you for joining us, and please see the website for the full disclosure and waiver. Thank you very much.